Millions of Americans will be paying higher insurance premiums under the Affordable Care Act. The government says that costs of mid-level health plans next year will go up by an average of 25%. Dan Diamond covers healthcare policy for Politico, has read this latest report. Good enough to join us now. Dan, we very much appreciate the time. There's lots to unpack here, obviously. But just first, for these increases we have heard so much about here for the last 48 hours or so, what will they mean for the average consumer?
For the average consumer, it probably won't mean that much, Josh. The number of people directly affected by these Obamacare premium hikes, really it's only about 8 million people. Now that's a lot, but when you think about the 300 million people or so who get covered by health insurance, it's still a fairly small group of folks who are directly being hit by the Obamacare premium hike.
Obviously, this became known some 2 weeks prior to Election Day. It could not perhaps then have been helped that it would not be politicized. What have you made of the Republican response to these revelations?
I think Republicans are predictably grabbing on this news. It's a little bit of a gift right before Election Day, to your point. This was always going to happen. The rumblings have been obvious for months and months that the rates were going to jump at this level. But I think what's tough for Democrats is it's not an easy thing to defend. Even though the rates are not going to affect a lot of people, it's still a bad headline. And Donald Trump, though fumbling the message originally, came around and used this as a very effective attack line on the trail yesterday. So Republicans around the country, especially down-ballot Republicans, can once again run on Obamacare as the specter of everything wrong with American health care and with the Obama administration.
Now, he had said yesterday on the stump repeatedly that with regard to this idea, the 25% average increase, he said, forget about that, folks. We're talking 60, 70, 80, even 90%. Those numbers refer to what?
So I think what you're referencing, Josh, is that some states are seeing really dramatic hikes. Arizona, 116% on average. The premiums on the Obamacare exchange will go up. Overall, though, the average is the average, about 25%. In some states, the premium hike will actually be flat or even negative next year.
It is worth it to point out that in the Health and Human Services report that this is, in fact, this increase is in line with projections that they saw back in 2009.
That is the argument that the administration keeps making. If I can be honest, I'm not sure I think it holds all that much water. On the one hand, yes, this is the number that they had projected 7 years ago for where Obamacare would be. The only difference is rather than kind of steadily reach this point, things went up fairly slowly, and this year was the big jump. But by the same token, that report that the administration keeps pointing to had a lot of other things that haven't come true about Obamacare. How many people would have signed up, for instance? So it's a little bit of cherry picking by the administration to say, hey, we got this one number right, but ignore all these other predictions that we made about where Obamacare would be in 2016.
And I know the enrollment numbers, or really lack thereof, have been a part of this. What were they thought to be, and where are they now?
So the enrollment numbers right now are about half of where they were expected to be on the exchanges. There are 10 million people or so who are buying directly through the Obamacare exchange. There were supposed to be maybe as many as twice that by this point, but there are lots of people who have gotten health coverage through Obamacare. They're just getting it through different ways. They're getting it through Medicaid, which expanded under the law. They're buying off exchange, which means that they are directly hit by these premiums because there isn't a subsidy to help them. But there are another 6 or 7 million people who are buying plans that are Obamacare compliant. They're just not doing it through the exchanges.
Now, Dan, you mentioned that this was a gift here, again, a couple of weeks out from Election Day. It could be argued, perhaps, that this is just the latest in a series of gifts as it regards the Affordable Care Act, that perhaps it even began with Bill Clinton, who just a few weeks ago called Obamacare the craziest thing he's ever seen. There are deeper concerns as they regard the marketplace here, and what are they?
Well, I think there are a couple, Josh. First, the concern around messaging that you're hitting on is right. It's a very tough law to defend and to keep defending year over year when the benefits aren't always obvious to most Americans. If anything, Obamacare is a little bit like glue. Concerns about health care just seem to stick to it, and things that go well in health care are harder to tout. I think the biggest challenges with Obamacare right now, one, the reason the premiums are going up so much is that the younger Americans that were expected to show up just haven't bought coverage through the exchanges. Another reason is that the insurance companies that were going to compete on the market, many of them have dropped out, and the less competition means it's easier to raise rates. The White House is working to try and get more insurance companies to come back into the market and also promote to millennials, to younger Americans, hey, this insurance plan is affordable to you, this is good for you, and frankly, you will save money in the long run by buying a health plan right now. So some complicated messaging from the administration, but one that they need to hit if they want this law to be as successful as they promised it would be.
Again, one of the graphics we just showed while you were speaking, again, that idea that 1 in 5 now will only have the option of a single insurance provider, which actually is not the definition of an option really at all. Dan Diamond of Politico, very complicated issue. We very much appreciate you deep diving with us.
Thank you, Josh.